So we have also heightened our surveillance on our points of entry. We are also encouraging that Kenyans who want to travel to places where this disease has been reported should consider suspending their visits unless it is essentially, it's very, very essential. We have set up places for isolation and treatment, 23 of them, and we don't want the politicization and the sensationalism that some of the members of the society are bringing into this very straightforward public health issue. So these isolation centers, the minister has assured me he will be visiting some of them so that we can look at our preparedness generally. And we do not want to politicize an epidemic. We have very many other things we can politicize if we must. And this is not an area for our discussion. So we have encouraged the minister and the team to continue with what they are doing. And we are very proud that our capacity is being upscaled, is being reviewed. We have a core number of health professionals, those who have experience in the past in West Africa on treatment of this disease. And we are building that capacity to include more health professionals. And finally, we'll be providing the personal protective equipment, both for health workers and for any person who may be handling people who may handle people who may get to their space. I want to also assure members of the public that we are taking measures for infection prevention control. We are also taking measures to provide the necessary operational and logistical support so that in the unlikely event of an occurrence of an incident, then that can be taken care of early, because what the Ministry of Health has advised us is that Ebola, risky and dangerous as it is, if it is detected early, treated early, isolated in terms of the patient getting out of the rest of the members of the public, there are very high chances that those patients will survive. The government, through the Ministry of Health, is making every effort to make sure that we prevent an occurrence of Ebola in our country. We are doing this in collaboration with our regional and international partners, the WHO, the Africa CDC centers, the US CDC centers, friendly governments, and I must commend the Ministry of Health for the leadership they have shown so far. The government offers maximum support to what you're doing to make sure that you protect our people from this very, very dangerous disease. We are calling on the members of the public not to panic, but also encouraging them, should one feel of symptoms that are unusual, it's good to look for medical attention just to make sure that we are all okay. And especially these are Kenyans living in counties along our borders, with the western side of our border, and also those who are within our points of entry, and those also who have contacts with the refugee camps and referral health facilities where these patients could be referred. So thank you very much. And the Ministry of Health has assured us of consistent update so that members of the public can keep knowing what government is doing. We have set aside enough resources to make sure that we manage the situation, and very soon we hope to come out of it. Thank you very much. So I think, colleagues, that's a fair brief.
It is 100,000, We have also inserted that cost within the request to
28 million beneficiaries. We have 19 billion disbursed. We have one
distributed 1,000 to the high-risk areas, that is Busia.
If you come to a designated point, we check your temperature. If it is abnormal, we isolate you.
They have inadequate documents, we return them back to the county facilities. And they're required to action them in full, but it created a claims office, and there are officers who look at claims. So what are the key issues? Documentation.
And we are also expecting an advance of 5,000 PPEs from the USG.
If you look at outpatient services for primary healthcare, they're the third ranking. Then you can see maternity, the amount of monies that